What's up, y'all? You're watching Union Minded. I'm your host, Eric, and today we're getting back to business. And what is the business for today? Today we're going to talk about UC San Francisco workers who are preparing to strike. Now, this story was published on October 31st, and I've wanted to get to it for a few days now, but there were other stories that were a little bit more pressing in my mind for unions in general, but this is a story that is also very important and one that we should pay attention to. So let's talk about it. Thousands of UC San Francisco workers are preparing to strike. Sean Singh said he feels angry that the San Francisco hospital emergency room where he works is so understaffed that patients often wait too long to get a bed. The UC San Francisco nurse case manager said he often assesses adults facing heart problems, kidney failure, septic shock, and other life-threatening conditions as they lie on gurneys or sit in crowded hallways, denied the dignity of a private space. They're in their most vulnerable moments with people walking by them in a hallway, in a public hall, receiving care while they wait for a bed upstairs, because there's just not enough staff to be able to plan discharges for patients and make rooms available, Singh, a 34-year-old San Jose native, said. In the 5 years Singh has worked at UCSF, he said hiring and retention problems have worsened, squeezing overworked employees and delaying patient care. The university has largely ignored pleas to improve working conditions, including during current labor contract negotiations that started in June, Singh added. He's ready to strike as a last resort. I'm there to fight for my patients, he said. The university is not bargaining with us in good faith. They're not going to the table with the sense of urgency that we want them to have to be able to hire more staff and retain staff. More than 4,000 healthcare research and technical workers at UCSF authorized their union to call a strike over what they say is the university's failure to bargain in good faith about short staffing and other top concerns. The members' vote, which concluded Wednesday, passed with 98% support, according to the University Professional and Technical Employees Local 9119, which represents more than 19,000 physician assistants, optometrists, clinical lab scientists, and other UC employees statewide. The threat of a walkout at UCSF comes as 37,000 UC service and patient care workers with a separate union, the American Federation of State, County, and Municipal Employees Local 3299, are also preparing for a potential statewide walkout. The strike authorization vote passed with 99% support. Ask Me said this on Thursday. Both unions filed unfair labor practice charges with the California Public Employment Relations Board this month, alleging that the university has refused to provide essential job vacancy and financial data needed to assess the extent of staffing crisis and develop solutions in ongoing contract negotiations. The charges maintain that the state's third largest employer has also acted illegally by announcing it intends to significantly increase employee health care costs, as outlined in an email to staffers, without negotiating over the changes. Healthcare workers said the move will exacerbate recruitment and retention issues. About 36% of UCSF employees said they felt burned out always or very often on the job, higher than the national healthcare average of 29%, according to a university staff survey last year. Patients spend an hour longer on average at the UCSF Medical Center Emergency Department where Singh works, compared to wait times at other large hospitals in the state and nationwide, according to Medicare.gov figures. Heather Hansen, a spokesman for UC's Office of the President, said the strike authorization votes by UPTI and AFSCME were disheartening but not surprising. It seems that no matter what we presented at the table, UPTI's move towards a strike was a foregone conclusion, Hansen said in a statement. We are disappointed and hope UPTI can reconsider its position and continue earnestly bargaining towards a mutually beneficial agreement. That is something I would expect the bosses to say. She added that the university's teams will keep bargaining across the system on proposals that include salary raises for UPTE members of 5% in 2025, 3% in 2026, and 3% in 2027. UC has also offered to increase pay for Asks Me workers by 26% over a 5-year contract, according to Hansen. She said the university is working to produce information on vacancy rate and other data on a rolling basis. Hansen added that health insurance contribution rates for UPTE represented employees are under negotiation, with UC offering credits to help offset these costs, though the union considers them insufficient. Bad faith has a clear and legal definition under the Higher Education Employer-Employee Relations Act, and we look forward to the Public Employee Relations Board reviewing and determining the merits of the charge, Hansen said. UC's response to those charges is due November 27th, after the university requested and received an extension, according to Felix de la Torre, General Counsel with the California Public Employment Relations Board. If an agency attorney finds enough evidence of an unfair practice by UC, the agency would issue a complaint and move the case to a settlement conference. Nationwide, short staffing is a common concern for hospital employees due to burnout and turnover, as many employers are generally opposed to investing more in their workforce because of the costs, according to Rebecca Given, an associate professor of labor studies at Rutgers University. Understand that when you actually provide substantial employees for a job, the job is safer, it's done at a better rate, there's less errors, but your profit margin goes down. And as we all know, in the United Corporations of America, profit margin is the biggest determiner of what a business will do, not what's best for the employer or the community. If they can get away with lowering staffing levels, they can increase their revenue, Givens, who has followed the healthcare industry for 25 years, said. Also, and so they would prefer to do that. That's what I just told you guys. The healthcare industry is very competitive, and employers, even those in public and nonprofit institutions, are focused on revenue and minimizing costs. Ding, ding, ding. Employers tend to make investments they believe will help them compete for patients, Givens said. They have to be in that sort of arms race to have flashier buildings and more amenities and better branding and advertising campaigns and all of those things which aren't really directly related to patient care, Givens said. But that's the healthcare economy that we're in. Liz Perlman, executive director at Ask Me Local 3299, said UC is prioritizing raises for top executives and chancellors and the construction of new hospitals in San Francisco, Oakland, and Sacramento and elsewhere, while keeping facilities dangerously understaffed and paying too little to many frontline staffers. Ultimately, we want more care. We want to provide more services, Perlman said. But the problem is, if you build buildings, but you don't take care of the people who work inside them, frankly, the buildings are worthless. This story is developing. And it is yet another example, clear cut, on how business will always look to maximize their profits. It makes sense. That's what they do. They are not part of our society. They are separate of our society. They're little kingdoms all around America, these businesses, and it's the United Corporations of America, little kingdoms. And we are subjects under these kingdoms. CEOs playing the role of king, management playing the role of the dukes and earls, and we are the peasants that have to deal with this. The thing about little kingdoms is subjects eventually get tired of the abuse and come together. So at each one of these little kingdoms, we need to develop unions in these little kingdoms. And when we do have unions, we need to talk to each other. We need to go to the meetings. We need to be in touch so that we know as a union what we want to accomplish, and we work together to get there. That is what collectivism is. That is what I believe in. That's what I keep on pushing for, and that's what I will continue to do. Remember that we have a union meeting this Friday with a very important motion on the floor, and it will be decided on Friday, with or without you being there. You should be there because you want your voice heard. This decision will affect you directly, whether you like it or not, know it or not. You want to be there so you hear all the information and you can vote. In your presence there allows you the right to vote, and you can have a say in what happens moving forward. My name's Eric. You're watching Union Minded. Remember that the fight's not left and right. It's up and down. It's going to take solidarity to win always. Each one teach one. Get out there and reach one. And remember, there can be no union without you and I. Front and center. Peace.